Here's 5 things we believe about healthcare that might make you unfollow us. Number 1 is normal doesn't always mean optimal. And a lot of times we're talking about laboratory work here and blood work that we do on the functional medicine side of our practice. Often we also see it on x-ray reports, and patients will come in saying, oh, I got this report. It says I'm normal, but my foot's numb. That's got to be not normal, right? Well, of course. Functional medicine, it's always a balance between the lab values that are in reference range versus what we think is optimal. With optimal lab values, not everybody should be put into the same box. And so sometimes what's normal for one person isn't normal for another. And so we always are going to talk about optimal lab values when we look at blood work with patients. Number 2, symptoms are really information. The way that the traditional healthcare system has evolved is we focus so much on the symptom. I have this problem or I have that problem. And when we just look at symptoms and we give something to cover up that symptom, whether that's medication, an exercise, a pill, a potion, or a lotion, once that intervention is taken away or stopped or discontinued, then, no surprise, the symptoms are going to come back. What we really want to look at and what we focus on here at Vitality is to really look at what's the reason you have this symptom, or you'll hear us talk about it all the time being the root cause. Good examples like having a rock in your shoe and it keeps irritating your foot and you keeps cutting through the skin. Well, you don't just keep putting a Band-Aid on it, right? You would take your shoe off, remove the rock, because the rock is a symptom why your foot is getting cut. And if you remove the rock, then eventually the skin's going to heal and you don't have the problem anymore, right? So it's root cause versus symptoms. And so that's a lot of what we're going to look at with a patient who says, oh, my foot is numb, or I have back pain, or I have a headache, or whatever the issue is. We're always going to be discussing with you what the root cause really is going to be, and you'll hear that a lot. One of the main reasons I'm even doing this post today is because, I don't know what's happened over the last month or two, but patients are coming in and they're going and having x-rays taken, or they have a problem, they go see their primary doctor, or they maybe do a consultation with a surgeon or something, and they're skipping right to the surgery. And that used to never happen. Maybe it's just a coincidence, I don't know, but it used to be, all right, I have back pain, let's try some medication. Oh, that doesn't work. All right, let's try some prescription medications instead of over the counter. That didn't work. Let's go do some injections, maybe some physical therapy. And 2 or 3 years later, now it's like, okay, you failed all of these other interventions. Now we can discuss surgery. But there are so many things you can do before you get to surgery. Just know that surgery isn't your only option. If you want more of an alternative approach or something that's non-traditional, meaning you don't take the medications or you don't want to do the steroid injections, or maybe you've tried all that and it hasn't worked, then we pride ourselves really on the physical medicine side of our business, which is our chiropractic program, our regenerative medicine program, and our rehab program that we have here. That's all sort of that middle ground where maybe you've tried medications and some epidural injections and physical therapy hasn't worked. You're looking for options, but surgery isn't an option. Either you're too young, you don't qualify, or it's not something you want to do. Then we're kind of that middle ground, so we can help you avoid needless drugs and surgery. And you don't just have to live with it. That's certainly a choice, but just know that you don't have to do that as well. Number 4 is the difference between healthcare and sick care. What really is billed as healthcare, those are mostly going to be based on treating a symptom. And for some of you that have done this, if you do stop taking medication, the symptom comes back. So is that a bad approach? I don't know. We are not anti-surgery, anti-medication. We're not anti-medicine. That's not what we're about. There's a time and a place for everything. You go to a traditional route of medical care, you're really going there because you're sick. You're saying you're sick and you're treated for sickness. But is there really a focus on health? And that's something I really encourage you to think about, where what we really focus on more is getting you healthy, keeping you healthy, and being healthy so we don't have to treat symptoms, and so you're really not sick. Number 5 is going to be something that lately people have been coming here because they're frustrated. They've been told that they're wrong about how they're feeling, or you shouldn't be feeling that way, or that's normal to not feel good. And that's not anything that we're telling people. It's just people inherently know that it's not right to feel certain ways, but yet they're being told, no, you're wrong. And that's, nobody wants to be told they're wrong. One thing that what we do is we listen. Our consultation is a half an hour, not just 5 minutes. And our team will look you in the eye and we will listen to your concerns. We will write them down and we will figure out a plan to help you with your concern. Your concerns are valid in our office. We do a pretty darn good job of this, I feel. And we have a very high patient satisfaction rate because when you listen to somebody and you listen to how they're feeling, you can really figure out what's wrong with them. And it's not really that hard. If you are feeling that way and you know that's not wrong, you don't have to accept that. And there, by the way, there's many people in our space that do this, not just us, but the alternative doctors that look at ways to help patients naturally are really going to probably be the people that are going to listen to you ultimately end of the day and help you find the means to the end of whatever problem that you're suffering from. In summary, if you forget anything else that I say today, just remember this: we will listen to you, and you need to be listened to as a patient. That's something I feel that you have a right to obtain. Ask better questions. We will ask better questions, of course, because we're trying to get to the root of the problem. But as a patient, you should ask questions too. And if you're not allowed to ask questions, then that might not be the right place for you. Look beyond your symptoms and just know that most traditional healthcare is going to look at your symptoms and treat that, but it goes beyond that. There's something behind that symptom, and that's what you really want to discover if you really want to find a true answer to your problem. Understand that you have options. You don't have to accept that it's only going to be medications, surgery, or medications, steroids, physical therapy, surgery, or you just have to go through some sort of an issue you're having with your healthcare and your labs are normal and you don't feel normal and no one's doing anything about it. There are answers in our space. When appropriate, we want to look at conservative options. You can be proactive. You can take a proactive approach to your health and do it in a way that's very safe, very natural, that has very few side effects. And before assuming that your only choice is surgery, please look at other options before you undergo something that could be irreversible, that usually you can't take back if it goes wrong. And that doesn't mean that surgery is bad. Not all surgeries are bad, and there are a time and place for all sorts of medicine, including alternative healthcare. And so you simply don't have to live with it. And if there's something that you have a question about, something that maybe you want an answer for, pop it down there in the comments, and it's probably something I could talk about in a future post. So thanks for listening.